As a mother or as a parent, you've witnessed these conversions. What are you going to do? So these conversions, it depends, because some baby will have a conversion actually for more than 5 minutes. Starts fitting, you see the baby fitting, it's fitting, and then even it takes more than 5 minutes. This baby is fitting. Or if it's for like 1 minute and or convulses for 1 minute, but now they are recurrent every after 5 minutes, this baby is convulsing. It is indicating a very serious illness within this baby. Yes, hello, our dear friends. My name is Dr. Silva. Today we'll welcome you to yet another episode of Ask Dr. Star, and we are tackling a very good question of what am I supposed to do when my child has convulsed. And it's a tricky one, because there are a lot of things that are concerned with the conversions of these babies. We are talking about pediatric conversions, which are caused by a lot of things, and which we want to bring to so that you can know where to take your child or how you're going to manage your baby. So convulsions are just abnormal fits children usually get due to a lot of things that are happening in their body. One of the causes of convulsions, the first one in babies, is we have what we call febrile seizures, or high grade temperatures or fever will cause convulsions. Two, we have what we call infection related. There we have bacterial meningitis, we have viral meningitis. So all those things, anything dealing with meningitis or affecting the meninges of the brain will cause what? Will cause convulsions in these kids. Two, we have trauma. Kids are always prone to getting trauma or traumatized. Getting out of the bed, they fall down, or from maybe climbing some tree, and then they fall down. So all those, and they fall down and then hit their head on the ground, it will immediately also cause some convulsions in this baby. Then we have also what we call convulsions may be related to the congenital anomalies. This baby is born with a tumor in the brain, and this tumor keeps on growing as the child is growing. It is edge against the what? Against the tumor, and the tumor actually is growing even faster than the age of this baby. So it becomes so big and then causes some problems in the brain, and then this baby starts getting recurrent convulsions. Then another thing that can cause convulsions to these babies is deprivation of this baby to maybe oxygen or blood supply. So it can also cause what? It can also cause these seizures. Now, the most common seizures we see in these kids are usually related to two things. One is infections, and then two, it is temperature related. Because these babies are still growing, so their thermostat or the thermoregulatory center is also growing. So the temperatures, if they become too high, is a way how they affect the thermostat, and then in that kind, the baby starts what? Convulsing. So the mother will not notice, will just notice the high grade fevers, but at the same time, I will have nothing to do about that, and then we'll just bring the baby, that the baby experienced one or two conversions before bringing the child to the facility. And then, of course, we talked about the tumors, expanding of these tumors, and in kids, they are very common. So if these tumors are also expanding, they can cause what? They can cause these convulsions. Now, as a mother or as a parent, you've witnessed these conversions. What are you going to do? So these conversions, it depends, because some baby will have a conversion actually for more than 5 minutes. Starts fitting, you see the baby fitting, it's fitting, and then even it takes more than 5 minutes. This baby is fitting. Or if it's for like 1 minute and or convulses for 1 minute, but now they are recurrent every after 5 minutes, this baby is convulsing. It is indicating a very serious illness within this baby. Two, also we have maybe convulsions related to hypoglycemia. This baby has not been feeding for a good while, or the mother forgot to breastfeed this baby or give food to this baby, and then he gets hypoglycemia, low glucose levels in blood, immediately it will trigger a convulsion. A child will start convulsing as well. And like we said, how is the mother going to, is to record all that history, because when you reach at the hospital, of which we say a conversion is a must take of a child to a hospital or to a nearby clinic, is that you have to know all this history that is happening in your baby, because the Musao will ask you what has happened, or what did you eat at night, for how long has this baby taken without eating, the temperatures, did you touch on this baby, how hot was the baby, or what had the baby eaten, all those kind of things. How old is the baby in your home? Do you have these drugs, a lot of drugs being packed, or do you usually get drugs from the pharmacy and then keep them somewhere? All these can cause conversions in babies, and this history must be remembered by the parent that is bringing this baby. And so what we advise the parent to do is, of course, get the clothing out of this baby if this baby is too hot, and then expose this baby. Put them in a position, in a recovery position. Maybe we shall teach you also how to put this baby in a recovery position, and then put off all the clothing so that you can allow this exposure, the temperature, the escape of these high fevers, of this temperature from this baby, and then somehow it will live on the recurrency of these seizures. Meanwhile, as you're arranging to take this child to a hospital, because that's where a definitive management will be made, depending on what they have found in this baby. If it is hypoglycemia, they will give something to taper out that. If it is high-grade fevers, they will also taper out that. If it is the drugs that maybe this patient has taken, they will know and then combat those drugs by giving the antidotes of those drugs this baby has swallowed. If it is the meningitis that is causing that, they have the antibiotics they will give the baby, and then they cool it down. They put down the organisms that are causing that. And if maybe this baby also requires any extra intervention, the hospital is in position to taper that down. Now, there is one problem parents usually think of when a child convulses, and that is the traditional things that come in. Yesterday was having the son of who, yesterday was having the daughter of this one, or was touched by someone from the other side. So we expect those things to be actually not there, because there is something that has happened to this kid and can be tapered from the hospital. So before thinking of traditional ways, please first take this child to the hospital. Then from the hospital, it's when they will tell you, I think maybe there are devoric things that are maybe coming in play. But they first taper out the medical stuff that are causing conversions to your baby. They can be treated, and the baby gets to normal health. So please seek for intervention for these conversions. Know what would bring the conversions, and every time you see a baby convulsing, that's an emergency. Take that child, or arrange ways, any quickest ways to take that child to hospital, and then they get treated, because it can be more than what you expect. If it is a brain tumor, you would not tell. If it is maybe hypoglycemia, maybe also you would not tell, because you don't have a glucometer in your home. If it is maybe high-grade fevers, you would tell the child had fevers, but you would not tell that maybe it is the one causing the convulsions. If the child has a lot of organisms in their blood causing septicemia, you would not tell, but at the hospital, they will tell. You get? So take your child. It is an emergency, and a conversion is a threatening thing, that maybe this child within if there is no any course of action that has taken place, this child is going to get what? Is going to get issues. So you deprive them of their good health ahead after even the treatment. So seek for medical attention. Take your children. All children who have convulsed, take them to hospital. Even if you witnessed only one convulsion and then the child gets okay, please go and know what has caused that convulsion. So I remain with Dr. Silva. Please, let's meet in the next episode. Thank you.